Chapter 9 is the urinary system. Let's go ahead and take a look at our new combining forms for this chapter. So the structure, underneath the structure, these are our terms. We have kidneys. Related combining form is nephrorenal. Renal pelvis is pyelo. Urine is uro or urinal. Ureters is ureter. Urinary bladder is cysto. Urethra is urethro. And prostate is prostatal. So the function of the urinary system, they maintain homeostasis by proper balance of water, salts, acids, by filtering blood flowing through the kidneys. Filtering blood to remove urea, creatinine, uric acid, and other waste products. And also converting waste products and excess fluids into urine in the kidneys and excreting them from the body. So the structures of the urinary system, we have 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. Here you can see in this figure structures of the urinary system. So here's your urethra, your prostate gland, here's your urinary bladder, right and left ureters, the abdominal aorta, here's your left kidney, right kidney, adrenal gland, and the left renal arteries here. The renal pelvis is there. So you can see the different structures here that they are showing of the urinary system. So the kidneys, they filter blood to remove waste products and excess water. They are located in the retroperitoneal space. They also assist with maintenance of fluid level, production of hormones, controlling blood pressure, erythrocyte production, and activation of vitamin D. We have the renal cortex. This is the outer region. We have the renal medulla, which is the inner region. Nephrons are microscopic functional units. The site of urine production using filtration, reabsorption, and secretion. We do have the renal artery, which supplies blood from the kidney to the nephrons, and then the renal vein carries filtered blood from kidney to bloodstream. Urine then is transported to the renal pelvis and collected in the preparation for entry into the ureters. The renal pelvis is a funnel-shaped area. This is surrounded by renal cortex and the renal medulla. This site is of urine collection before it flows into the ureters. The ureters then are the 2 narrow tubes transporting urine from kidneys to the bladder through process of peristalsis. The ureteral orifices allow draining of urine from ureters into the bladder. The urinary bladder then is located in the anterior portion of the pelvic cavity. It's just behind the pubic symphysis. It's a muscular reservoir for urine. The urethra is a tube extending from the bladder to the exterior of the body. The urinary sphincters located at either end of the urethra control flow of urine from the bladder to the urethra and from the urethra to the urethral meatus, which is an external opening of the urethra. The female urethra is approximately 1.5 inches long, and it transports only urine. The male urethra is 8 inches long, approximately 8 inches. It transports urine and semen, and this is surrounded by the prostate gland. The excretion of urine, also known just as urination, voiding, or micturition, requires coordinated contraction of bladder muscles and relaxation of sphincters. Let's take a look at the medical specialists related to the urinary system. The first one we have is nephrologist. So looking at this term, we're able to break it down. Nephrologist, kidney, logist is specialist, so specialist in diagnosing and treating diseases and disorders of the kidneys. Urologist then, UR is urine. Ologist is specialist, so it's a specialist in diagnosing, treating diseases and disorders of the urinary system of females and the GI system of males. We have nephropathy. Looking at this term, nephro is kidney, path is disease, so it's a disease of the kidney. Renal failure then is just improper function of one or both kidneys. Azotemia is just an elevated BUN due to lack of blood flow to kidneys. Uremia, this is a toxic condition resulting from renal failure. UR is urine, emia is blood condition. Urea and other waste products are retained in the blood. Acute renal failure This is a sudden onset of uremia. It is fatal if not reversed promptly. Then we have chronic kidney disease. This is a progressive loss of renal function and can also be life-threatening. We have end-stage renal disease. These are the final stages, or the final stage of chronic kidney disease. It is fatal unless kidney function replaced by dialysis or a kidney transplant. Nephrotic syndrome. Looking at this term, nephro is kidney, tic is pertaining to, so it's pertaining to kidney. Next, we have edema. This is excessive fluid accumulation in body tissues as symptom of nephrotic syndrome or other kidney diseases. So there's just the excessive fluid accumulation in body tissues. Hyperproteinuria. This is abnormally high concentration of protein in the urine. So hyper is excessive, protein is protein, and urea is urine. So abnormally high concentration. Hypoproteinemia is abnormally low concentration of blood or concentration of fluid. Or let me start all over with that one. Hyperproteinemia, abnormally low concentration of protein in the blood. And looking at this term, we can break it down. Hypo is deficient or decreased. Protein is protein. Anemia is blood condition. And this may also be associated with hyperproteinuria. Let's take a look at some abnormal kidney conditions that they have here. So we have hydronephrosis. This is hydro is water, neph is kidney, os is abnormal condition. So breaking the term down, it's abnormal condition of water on the kidney. Nephritis is inflammation of the kidneys. Glomerular nephritis is inflammation of glomeruli, causing erythrocytes and proteins to leak into urine. Again, we can break this down. Itis is inflammation, nephro is kidney, and glomerulo is glomeruli. We have nephroptosis. This is prolapse, drooping or sagging of the kidney. Nephro is kidney, ptosis is droop or sag. Nephropiosis, nephro is kidney, pi is pus, os is abnormal condition. So it's abnormal condition of pus, the kidney. We have polycystic kidney disease. This is a genetic disorder. And looking at this term, we certainly can break that down. Poly is many, cyst is cyst, IC is pertaining to. So it's pertaining to many cysts in the kidney. Renal colic. This is acute pain in the kidney. It's caused by blockage during passage of a kidney stone. Very painful. We have Wilms tumor. Occurs in young children, and it is a malignant tumor of the kidney. It's a rare type of malignant tumor. Let's take a look at the stones, also known as calculus. It's an abnormal mineral deposit formed within the body. The medical term that we have is nephrolithiasis. Nephro is kidney, lithiasis is the presence of stones. So it's the presence of stones in the kidney. Some more medical terms, nephrolith is nephro is kidney, lith is stone, so it's a kidney stone. Uterolith, located in the ureter. Cystolith, located in the urinary bladder. Cystobladder, lith is stone. And you can see here in this figure, the stones. We have the nephrolith here. You can see the stones there. This is the uterolith and the cystolith. And then the calculi being expelled through the urethra. You say it's a very painful, if you ever had kidney stones, you know then it's very painful to go through that. Let's take a look at the ureters. We have hydroureter. Hydro is water, ureter is ureter. It's a distension of ureter with urine due to blockage. Then we have uteroectasis, distension of ureter due to hydroureter or congenital abnormalities. Ectasis here is enlargement. Ureter is ureter. Uteroragia is discharge of blood from the ureter. Ureter, and then ragia is the bleeding. Cystalgia, some more medical terms that we have. Also could be cystodynia, both mean the same thing, just pain in the bladder. Cystocele is hernia of the bladder. Cysto is bladder, cele is hernia. Interstitial cystitis is chronic inflammation within bladder walls. We have the vesicular ureteral reflex. This is just the backward flow of urine into ureters from the bladder. Vesicovaginal fistula is an abnormal opening from the bladder to the vagina, and it allows constant involuntary flow of urine from bladder to vagina. Breaking it down, vesicle is bladder, vagin is vagina, vagina, AL is pertaining to. You have neurogenic bladder. Neuro is nerve, genic is created by, so it's caused by interference of normal nerve pathways associated with urination. It may cause urinary incontinence, and it also may cause inability to empty the bladder. Neurogenic bladder is that called. The prostate gland is one of the most common cancers in men. The term that we have here is prostatitis. It's just an inflammation of the prostate gland. Urethroragia, bleeding from the urethra. Urethruria is abnormal discharge from the urethra. Again, you can break both of those terms down with your medical. Erythrostenosis is narrowing of the urethra. Stenosis is tightening or narrowing. Abnormal urethral openings, epispadis, the congenital abnormality in the male. It's the urethral opening located on the upper surface of the penis. In the female, the opening is located in the region of the clitoris. Hypospadis. I think I just did that one, didn't I? Let's go back one. So did I have okay, hypospadis. Okay, so this is the male is the urethral opening is on the ventral side, ventral surface of the penis, and the female urethra opens into the vagina. Okay, so hypospadis is that one. Cystitis. Itis is inflammation. Cyst is bladder, inflammation of the bladder. Polynephritis. Again, we can break this one down. Polio is renal pelvis, nephro is kidney. So it's inflammation of renal pelvis and kidney. Pyelo. Urethritis is inflammation of the urethra. Anuria, absence of urine formation. Diuresis is increased output of urine. Di is through, uresis is urination. Dysuria is difficult, painful urination. And enuresis is involuntary discharge of urine. We have nocturnal enuresis. This is urinary incontinence during sleep. Nocturia, this is excessive urination during the night. Noct is night, uria is urination. Oliguria is scant urination. Olig is scanty, uria is urination. Polyuria, excessive urination. We have urinary hesitancy, difficulty in starting urine stream. And then we have urinary retention. This is an inability to completely empty the bladder. Incontinence is the ability to control excretion of urine, feces, or both. We have urinary incontinence and overflow incontinence. Also stress incontinence. This is more common in women. It's an inability to control voiding under physical stress, such as running, sneezing, laughing. And then we have the overreactive bladder. This is where bladder muscles contract involuntarily when the bladder is not full enough to indicate need to urinate. Let's take a look at some diagnostic procedures. So urinalysis, this determines the presence of abnormal elements. We have a bladder ultrasound, also assists with visualization of stones. Elevation of bladder by enlarged prostate or measuring of residual urine. We have urinary catheterization. This is where they insert a tube into the bladder. Procedure must be performed under sterile conditions. We have a cystoscopy. Cysto is bladder. Scopy or scopy is visual examination. So it's visual examination of the bladder. We have voiding cystourethropography. We have computed tomography. We have glomerular filtration rate. Some more of the diagnostic procedures. Let's take at the radiographic examinations. We have cystography. It's X-ray examination of the bladder. Intravenous pyelography. This is where it provides image of kidneys and ureters. We have KUB, kidneys, ureters, and bladder. This assists with detection of bowel obstructions and nephrolytic stones, which are kidney stones. We have retrograde urography. Observes upward flow of urine. With a digital rectal exam, well, these are for the prostate gland. This is for the prostate gland. So it's just, and the other one then is a prostate-specific antigen blood test. It does screen for prostate cancer. So a couple procedures that can be done for the prostate gland. Treatment procedures, so medications, obviously, diuretics, antibiotics, antispasmodics, and nutritional interventions are some of the treatment procedures. Also, dialysis is another one. Dia is complete or through. Lysis is separation. Removes waste products and excess water from blood when kidneys do not function properly. We have hemodialysis and peritoneal dialysis. The kidneys, let's take a look at some of our medical terms here. Nephrolysis is surgical freeing of kidney from adhesions. Nephropexy, surgical fixation of the kidney. Nephrostomy is placement of a catheter to maintain opening from pelvis of one or both kidneys to exterior of the body. So neph is kidney, ostomy is creation of an opening. Pyelotomy, surgical incision of the renal pelvis. Then we have a renal transplantation. This is where they grafting of a donor kidney to replace recipient's failed kidney. Treatment then of nephroliths. They can do the ESWL. This is the shockwave lithotripsy, where they actually crush stones. Litho stone, tripsy is to crush. The other percutaneous nephrolithotomy. This is a surgical removal of nephrolith through small opening in the back. The ureters, we have uterectomy, surgical removal of the ureter. Uteral oriphy, surgical suturing of the ureter. And then we have the uteroscopy, treatment for nephrolith lodged in the ureter. The urinary bladder, cystectomy. This is just surgical removal of all or part of the urinary bladder. We have the ileoconduit. This is use of small piece of intestine to convey urine to ureters and then to abdominal stoma. We have the cystopexy. This is a surgical fixation of the bladder to the abdominal wall. So a few more medical terms. Hysterorrhaphy, surgical suturing of wound defect in the bladder. Then we have the lithotomy. It's a surgical incision for removal of the nephrolith from the bladder. Let's look at the urinary catheterization. That is a sterile procedure. We have indwelling catheter. Catheter remains inside body for a prolonged time. And the most common that you'll see out there is the Foley catheter. Then we have the urethral catheterization. This is where they insert the catheter through urethra and into the bladder. We have the suprapubic catheterization, placement of the catheter into the bladder through small incision in the abdominal wall just above the pubic bone. And then we have the intermittent catheter. This is where it's inserted as needed several times per day to drain urine from the bladder. The urethra, so let's take a look at our medical terms for this. Meatomy is just surgical incision in the urethral meatus. That's to enlarge opening. So meat is meatus, otomy is a surgical incision. With the urethroplasty, so it's surgical repair of the urethra. Urethrotomy, urethrotomy, yeah, okay. Surgical incision into the urethra to relieve stricture. So looking at this term also too, we can break this down. Urethra is urethra, otomy is surgical incision. So it's surgical incision of the urethra. Some things for the to treat prostate. We have ablation, is just removal of a body part or destruction of its function. We also have then a prostatectomy, just surgical removal of the prostate. It could be all or part of the prostate gland. We have what they call TURP, transurethral resection of the prostate, with the use of rectoscope to remove excessive tissue from large prostate gland. Radiation therapy and hormone therapy. This is just additional treatment for the prostate gland. And then the last one they have is watchful waiting, maybe prescribed approach due to slow progression of prostate gland. So you're just going to watch and wait and see it and watch it. Some urinary incontinence training. So bladder training is behavioral therapy in which the patient learns to urinate on a schedule with increasingly longer time intervals as the bladder increases its capacity. So you can see that this is also some training that can be done, urinary incontinence training. And that is it for the chapter. It was a nice short chapter. So please go to your workbook and complete the exercises for this chapter. And thank you for listening.